Welcome to Backus Health Beat, your source for the latest health news and information. Today we have with us Dr. Scott Stannett, and Scott is an orthopedic surgeon with the Norwich Orthopedic Group and a member of the Backus medical staff, and he also specializes in joint replacement surgeries.
Well, thank you for having me, Sean. Glad to be here today. I'm glad to have a little discussion about the new and what's advanced in hip replacements.
I was actually reading recently that hip replacement surgeries have doubled since the year 2000. Is that accurate, and can you explain that?
That is accurate, and actually that trend is going to increase pretty substantially over the next 15 years, and that by 2030 we'll be doing about 500,000 total hips a year and 3 million knees a year. So that's definitely a big workload.
Wow, that is really that's a lot of surgeries, and these are elective surgeries, and I would guess that it has something to do with the baby boomer generation.
Yeah, you know, the reasons for this are many, and one of the main reasons is the baby boomer generation. There's a large number of people coming of age of the joint replacement age, but they've actually used their hips a substantial amount throughout their life, and they're very active. They have had many experiences that prior generations haven't had, and this increased effect is more wear and tear in the hip joint. And in fact, you know, a lot of these people are getting total hips even at that age and a younger age. The advances in this medical field, specifically with the implants, do allow us to use these in a younger set of individuals. Now, the implants have come along to the point where they last longer. The way we put them in, they're more bone conserving, meaning that we can use a smaller implant for the same type of procedure that we did in the past. And if, in fact, it was used on a younger patient and they need to have another surgery later in their life, hopefully not, but it would possibly make that revision surgery easier and more bone conserving and more successful later on. Plus, the way we put these in with muscle sparing approaches where we don't have to release any of the muscle off the bone or tendons, and we basically go between the muscles, allow us to have a higher functioning, more normal implant after the surgery.
Who is the typical candidate for a hip replacement surgery? I'm sure someone doesn't just walk in and say, my hip hurts, can I have surgery? I'm sure it's not that easy, right?
No, that's definitely the case. There is a very specific patient who applies for hip replacement surgery. Many of the hip pains or joint problems are not arthritis and often do not need to be replaced. Mainly, the cushion of the hip is the cartilage of the hip. This allows us, when we're younger, to have a well-functioning hip with no pain, and it acts in a smooth motion. Throughout life, this can actually wear out, which is degenerative joint disease or arthritis. This can also be caused from other reasons, such as rheumatoid arthritis, necrosis of the bone, or trauma such as fractures. But when these begin to wear down on the cartilage surface, and this causes pain and disability to the hip, we start to, based on x-rays, think about this procedure. Now, the patient generally would want to try and make their hip that they're born with last as long as possible. This includes activity modification, oral medications, and even steroid injections. But when the pain is to the point that their activities of daily living are severely affected, or they can't function how they like to function with the hip that they have, then we start to have a discussion about a hip replacement surgery.
What is the normal recovery time for somebody who gets hip replacement surgery?
Well, the recovery time nowadays is much shorter and faster than when we used to do them. Decades ago, you might stay in the hospital a week. Wow. Now you're only in the hospital a couple nights for many different reasons, but you're up and walking the next morning, and if your surgery is done that morning, we like you to get up and walking later that day even. And with our increased better effectiveness of the pain control that we have nowadays, we're able to get you up and going in a significantly faster time than we used to.
Hi, I'm Ann Hutchins, and I had total hip replacement on my right hip in January of 2013. And in 2 weeks I was up and walking around. Everything went great. I feel wonderful. I feel very confident now about walking around, and my mobility and stability are great.
Most patients will return to work within about 6 weeks or so, plus or minus. And that's for someone who isn't necessarily going out there and building buildings, but the average job that you might have. And many people are very happy with their hip, even right away. Oftentimes that chronic deep-seated hip pain that you have that's almost gone, sometimes even the day after surgery or in the recovery room.
I get my hip replacement surgery, I'm out of the hospital, I'm back to work. Should I expect to have the same range of motion, the same capabilities that I did earlier in life, or how does that work?
I would think that that would definitely be the case. And in many patients, they're very happy with their hip. The hip that we give them is far superior to the one that they have right before the surgery. And it definitely functions very similar to the one that they've had earlier in life. With a muscle-sparing approach, there are no restrictions. They're full weight bearing right after the surgery. There's no limitations of any range of motion with the newer approaches. And especially with the new implants, the range of motion that the implant can provide is very similar to the range of motion they had before. Many patients are back to doubles tennis, doing their activities, swimming, and very happy with the level of physical fitness that they could get after the surgery, and being able to return to sporting events that decades ago we would say, well, you're definitely not doing any sports on this, but now we're getting more comfortable with allowing them to really use their hip as we've given it to them.
Well, Dr. Stannett, I mean, we've learned a lot here today about hip replacement surgeries, and I want to thank you for taking the time to be with us today. And you know, maybe we'll have you back on real soon to talk about these advancements, because it seems like things are happening real fast.
Well, they definitely are, and there's a bright future. And thank you for having me.
All right, thank you.